In terms of the last death that we had yesterday, it's that of a 81-year-old male diagnosed in Orange Walk, who had been at the Northern Regional Hospital from October 8th, I believe. So he was there for almost 2 weeks until he died in the early hours of yesterday morning. We are reviewing all the lab data and all the data in terms of people who would have had sudden deaths or people who would have died without being referred to Carlutioners. So there's a couple of persons from headquarters that will be in Orange Walk later on in the week and early next week to review the specific management of those patients and to see if there is any other situation that may be brewing and that we are not aware of. As you would have noted, in terms of the age groups, in terms of people dying, we have had a 26-year-old female. That's the youngest person that has died for our context. So I think we need to be aware of that particular situation. So that person is the youngest, is a female, and if you notice the infographic that we had published earlier in the week, most of the cases of people dying have been in the older age group. So that now we have 16 people out of the total for the 6 deaths that have been recorded. That's 1/3 of cases are in people older than 65, and if you bring down the bracket to people older than 55, that means people in the retirement age. That is 34 out of the 46 people that would have died would have been older than 55 years of age. But again, you look at that data and you find out that, as I have said, we have had cases and people younger than 30.